Fever is one of the most common symptoms of illness, and it plays a crucial role in the body's defense system. But have you ever wondered what actually happens inside your body when you have a fever? Why do you feel chills, sweat later, or lose your appetite? And most importantly, when should you be concerned? Today, we'll break down everything you need to know about fever, its causes, effects, how to manage it, and even how it impacts pregnancy. We'll also explore why mucus changes color, why some people experience nosebleeds during fever, and what your body is really trying to tell you. So make sure to watch till the end, because this information could be life-saving. When viruses, bacteria, or toxins enter your body, your immune system detects the threat and releases special chemicals called cytokines and pyrogens. These chemicals send a message to the brain's temperature control center, the hypothalamus, telling it to raise your body's thermostat. But why does the body do this? A fever isn't just a random symptom, it's a defense mechanism. Raising the temperature actually helps your immune cells work faster while slowing down the ability of viruses and bacteria to multiply. As your temperature rises, you might start shivering. That's because your muscles are generating extra heat. Your blood vessels tighten to conserve warmth, making you feel cold, even when your temperature is climbing. Eventually, once your body no longer needs the fever, the hypothalamus lowers the temperature, causing sweating to cool you down. Infants and young children can develop high fevers even from minor infections because their immune systems are still developing. A fever over 100.4 degrees Fahrenheit, or 38 degrees Celsius, in babies under 3 months, should be taken very seriously, as they have weaker defenses against infections. Adults can usually tolerate fevers better, but prolonged fever could signal an underlying condition, such as a bacterial infection, autoimmune disease, or even heat stroke. Elderly individuals may not always show a high fever, even with severe infections. This is because their immune system weakens with age, meaning a lack of fever doesn't necessarily mean they're not sick. Fever doesn't just raise your temperature, it affects almost every part of your body. You might experience headaches, a faster heartbeat, fatigue and chills, loss of appetite, an increased breathing rate, and muscle weakness and body aches. Your mucus color can actually reveal what's happening inside your body. Clear mucus is normal, but excessive amounts may indicate allergies, viral infections, or irritation from dust or pollution. White mucus indicates nasal congestion and thicker mucus, which is common in the early stages of a cold or mild infection. Yellow mucus suggests your immune system is actively fighting an infection. The color comes from white blood cells attacking the invaders. This is common with colds, flu, or sinus infections. Green mucus means your immune system is in full battle mode. It's caused by dead white blood cells and bacteria. If it lasts more than 10 days or comes with fever and facial pain, it could indicate a bacterial sinus infection that might need antibiotics. Brown or rust-colored mucus could contain old blood from irritated airways, often due to prolonged coughing, chronic bronchitis, or smoking. Red or pink mucus signals fresh blood, possibly from a severe sinus infection, nasal injury, or lung conditions like pneumonia. Black mucus is rare but could be from smoking, heavy pollution, or fungal infections, which require urgent medical attention. Before we continue, if you're finding this video helpful, make sure to like this video and subscribe to our channel. We bring you the best health tips so you and your loved ones can stay informed and safe. And don't forget to hit the notification bell so you never miss an update. Some people experience nosebleeds or bleeding gums during fever. Here's why. Dehydration from fever dries out nasal membranes, making them fragile and prone to cracking. Increased blood flow raises circulation, increasing pressure on weakened blood vessels. Some bacterial or viral infections can damage small blood vessels, causing mild bleeding. Low platelet count from certain fevers like dengue or viral hemorrhagic fevers can make bleeding more likely. Fever during pregnancy isn't just uncomfortable, it can sometimes signal an underlying infection or pose potential risks to the developing baby. During the first trimester, which is weeks 1 to 12, High fever is linked to neural tube defects like spina bifida. Studies also suggest that a prolonged fever may double the risk of miscarriage. It can also affect heart and facial development, increasing the risk of cleft lip or cleft palate. Taking prenatal vitamins with folic acid can reduce neural tube defect risks. During the second trimester, which spans weeks 13 to 26, fever can increase the risk of preterm labor if caused by infections like UTIs, pneumonia, or bacterial vaginosis. Fever might also contribute to mild cognitive and motor skill delays in the baby. Treating UTIs or respiratory infections promptly is crucial to prevent fever spikes. During the third trimester, which is weeks 27 to 40, fever above 102 degrees Fahrenheit or 39 degrees Celsius can trigger contractions and increase the risk of premature birth. Dehydration caused by fever can reduce oxygen supply to the baby, which may affect.
If you feel uterine contractions or decreased fetal movements, seek immediate medical help. Most mild fevers can be managed at home with rest hydration, cool compresses, and fever-reducing medication like acetaminophen, which is the safest option, especially for pregnant women. Seek medical attention immediately if fever is above 104 degrees Fahrenheit or 40 degrees Celsius, or lasts more than 3 days. Fever comes with chest pain, confusion, or difficulty breathing. An infant under 3 months has a fever over 100.4 degrees Fahrenheit or 38 degrees Celsius. Fever is accompanied by persistent vomiting or dehydration, or pregnant women experience a fever above 102 degrees Fahrenheit or 39 degrees Celsius, or lasting more than 24 hours. Now that you know everything about fever, mucus colors, and bleeding symptoms, you're better prepared to take care of yourself and your loved ones. If you found this video useful, subscribe now so you never miss an update. And don't forget to check out our other videos for more in-depth health tips. Thanks for watching and stay healthy.